I want to switch gears just a little bit and drill down into something that is moving the markets today, and that's the latest with coronavirus. And a big reason why we're seeing stocks move to the upside today is this news that we got from Gilead, and Gilead saying that Remdesivir data showing that it can reduce the risk of death in coronavirus patients. And I want to bring in Dr. Isaac Bogoch for more on this. He's an infectious disease specialist. And Dr. Bogoch, when you take a look at the news that we got out of Remdesivir, a sign that maybe it will go beyond just speeding up recovery, how encouraged should we be by this new development?
I think we should be slightly encouraged, but by no means is the data that was presented today definitive. In fact, it was a little bit unusual. They presented some data that was collected in a prospective manner with other data that was collected in a retrospective manner, and they're making claims about mortality benefit. I think, listen, data is not all created equally, and it's hard to draw definitive conclusions from data of varying qualities. The best data available would be if we had prospective data comparing remdesivir to placebo, and we don't have that long-term data just yet. I think it's going to be forthcoming, and it'll be very interesting to see if there's actually mortality benefit with this drug. I don't think we can conclusively say that just yet with the data that's available.
Dr. Bogoch, what is the potential timeline for that data that you are looking for? When are you expecting to see that?
Now, I think the data should be available from the earlier remdesivir trial. And in fact, they did publish some of the earlier data in the New England Journal of Medicine, and this was excellent. I mean, it showed that remdesivir could certainly shorten the length of stay in hospital for people who received the drug. It was very promising. And I know that it's now being used in many places in the United States. There's another drug that's far cheaper and far more accessible than remdesivir. That's a steroid that was used, and that was found in a United Kingdom study that really was shown to actually have mortality benefit for people who are hospitalized and requiring oxygen.
Hey, Dr. Bogoch, Rick Newman here. These drugs are actually being used to treat patients with COVID in hospitals now, right? I mean, so can you just tell us where we stand on the treatments that are available and how they have improved during the last few months?
Yeah, so it's really interesting. There's been a lot of studies that have come out with for drugs that treat COVID-19. But to date, we only have 2 drugs that have really been shown in good trials, meaning prospective studies that are randomized, that are placebo-controlled, like well-conducted studies that give us the highest caliber of data. And those drugs are remdesivir, which we know shortens hospital length of stay, and then dexamethasone, which is a steroid drug that we see can reduce the probability of death. In real-world settings, I would say that dexamethasone is now being used probably globally because it's cheap, it's widely available, and it's shown to be effective, and it's readily accessible in most parts of the world. So I think most people have integrated that into their routine clinical care. Remdesivir is interesting. I mean, I appreciate you're in the United States. I'm calling you from Canada, and I can speak on behalf of most of my other friends and colleagues around the world. We don't really have access to remdesivir. The United States bought most of the stock of remdesivir for at least the next 3 months. So it's very hard to get access to that drug. So I think most people outside of the United States are using dexamethasone.
Doctor, I have a question on testing and the delays that we're seeing on that front, because it does seem like in some ways we're back to where we were in March or April, where there are people who are talking about, not just 3 days, but waiting 5 days and 6 days for the testing results to come back. I just had a test a few days ago that did a rapid test that came back in 15 minutes. What is the holdup right now in getting to that point? Because ultimately, if we can't get the test turned around quickly enough, I imagine it makes it even more challenging to control the infections.
Yeah, that's a very good point. And certainly we would want rapid turnaround tests so that we can inform people of a positive or negative result and provide meaningful counseling to those individuals. Now, when you're in a situation where, for example, you're in Florida, where there's over 9,000 new cases per day, or in California or Texas or Arizona, and those are the obvious places, but there's a lot of other places in and around those states as well, where there's just a tremendous number of positive cases. You really need significant testing capacity. And there might be public health labs and other laboratories that are conducting these tests that might just be getting overwhelmed. And when you have such a high volume of tests to push through, it can reduce the efficiency of the lab, and certainly there can be delays. And of course, we know what the outcome is. It's like a chain reaction, a spillover effect. If the tests take longer, people don't get informed of the results. They might be unknowingly transmitting the infection to other individuals. Contact tracing can't be done to inform close contacts of those individuals. And it's a snowball effect. And you see exactly what you're seeing now, sadly, in many parts of the United States, where things are getting worse and not better. I don't think there's one piece to the puzzle. I think there's multiple pieces that have to be placed in order to get this under control.
So I want to ask about hydroxychloroquine, the drug that President Trump said he took going back a couple of months. Has that been completely disproven or debunked as a treatment, or is it still unknown? Depends on who you ask. If you ask most people who are in medicine or in science or epidemiology, I think we're finding fewer and fewer reasons to think this drug is going to work. There's been some high caliber studies that have demonstrated that this is just not an effective drug to use. And again, let's depoliticize it. Let's just talk about science and data and evidence. And it just does not appear to be effective. And I appreciate that some people will say, well, look at this study, well, look at that study. And that's fantastic. But we have to appreciate that not all data is of the same caliber. And in the higher caliber studies, this does not seem to be effective in either preventing COVID-19 infections or treating COVID-19 infections. So again, I think based on what we have today, it's unlikely that this drug will be a useful drug in the fight against COVID-19.
And Dr. Bogoch, I just want to get your take on the school debate that's happening in the U.S. And I know you're joining us from Canada, but from what you're seeing playing out and the rising number of cases, the fact that we are still recording daily record cases in the U.S., President Trump is pushing the fact that he thinks schools should reopen in the fall. Where do you stand on that? And do you think it's too risky at this point to make that type of call?
Oh, this is a fascinating debate because even in Canada, where we actually have this infection under pretty good control across the country, we are also having that exact same debate. And there are lots of opinions strongly to go back to school, strongly, of course, opposing going back to school, and everywhere in between. I think we have to appreciate several different features. One is that school is extremely important, not just for education, but for many other reasons: food security, ensuring the economic well-being of families, social well-being of children, et cetera, et cetera, et cetera. I think we can all agree that school is important. The other thing is we also have to appreciate that even though they're children, we know that A, children can get infected with this virus, and B, children can transmit this virus. So we know that those are features as well. So if and when kids go back to school, I think it's extremely important in order to do this in the safest manner possible. And we also have to appreciate that there's no one-size-fits-all solution. There has to be tremendous flexibility. It might be too dangerous for an individual kid to go back to school. It might be too dangerous for the family to send a kid to go back to school because of who that child might come back to. So there has to be tremendous flexibility in our pre-vaccine era. If it can be done safely, meaning hand hygiene, physical distancing, masks where masks can be used, appreciating that some little kids won't be able to wear masks, protecting the other people that are in the school. Yeah, I think I'm all for it. I think, though, it's even hard to have that conversation when the burden of infection is so high in a community. I think the first step is lower the burden of infection in the community rapidly, and then start to talk about going back to school safely.
Making a lot of very, very good points. Dr. Isaac Bogoch, Infectious Disease Specialist, always great to get your perspective on the program. Thanks so much for taking the time to join us today.
Have a great weekend.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.